we read about the Great Barrington Declaration, in which they say that the best way, essentially, to approach herd immunity is by basically not locking down and allowing people to be naturally infected in the faith that most of these infected individuals will most probably survive it and develop immunity along the way. Now, how much of that is actually based on data? Dr. Homer or Dr. Iggy?
Yeah, the Great Barrington Declaration is actually trying to make us approach some form of herd immunity in the safest way possible. That's actually the aim of what they call the focus protection means of getting there. So it's not really trying to get everyone infected. In fact, that's not what it's trying to do.
Okay.
It's trying to protect the elderly and the vulnerable from getting sick as we approach herd immunity. So that's what it actually is.
Yes. Okay, so tell us, what is wrong with the current approach, that there needs to be a declaration that essentially goes against what we conventionally now believe to be the protocol?
Well, first of all, lockdowns have been shown not to be effective. And this is based on many published studies already. And one of the first observations was made by Professor Michael Levitt in China. And he noticed that the numbers of deaths and cases were already dropping down even before lockdowns. And then it's already December. There are more than 22 published studies already which shows it doesn't work. Second, lockdowns are expensive, not only of economy, but of employment, of deaths, from misdiagnosis, from mishealth cases, because we're concentrating too much on COVID. So, in fact, I think they quoted the WHO that 130 million people are expected to be hungry this year because of lockdown limitations caused on the worldwide economy. So that's a big number, 130 million people. So,
But on the other hand, doctors, nakikita naman natin what happens kapag hindi naman nagla-lockdown. Because like in Europe and in the US, they're saying second and third waves. And nakikita, they trace it to the return of the movement of people and the gathering of more people, the opening of businesses where people can gather like in restaurants, dining, mga gyms. Ano bang nakakalito na, di ba? Paano naman yon kapag gano'n yung nakikita natin?
Yeah, it's like this. There will be new cases, and different countries will have new cases, another wave, so to speak. But lockdowns don't affect them. They happen because they will happen. Because it's coming into winter, so most seasonal viruses actually increase with in winter. But countries, for example, like Sweden, who did not have lockdowns, have been less affected. So it actually just shows you how lockdowns don't really work. Because if a country like Sweden that did not lock down are getting less numbers now, so that seems to be the opposite of what's happening. Because we're trying to say that the reason there are cases because they are lifting lockdowns. That is not causal. Hindi siya direct relationship. It might be increasing because of other reasons.
Like what? Like what would be the other reason?
Yeah, like for example, it's getting into winter, so that's one of the reasons.
Yun na nga.
Yeah, and then there's also, because lockdowns have actually caused us to be unhealthier. We have less vitamin D, for example. Of course, people, as we go old by 1 year, people develop diabetes. Some people get obese during this period from the last time that we had the first wave. But as you notice, the new wave is not as big as the first one. And it's classic of most viruses. And many books about how viruses behave, it's like that. You have a first wave that's big, and then the following one is not so big.
Well, Doc Iggy, if I may, if you could just walk us back a little bit, I just want to be sure that we're all clear, and especially the audience, that the audience is very clear with regard to this point of view. Because to a lot of people, it does sound, counterintuitive, and it does sound like it goes against everything else that we've been told in the last 8 or 9 months. So para lang po klaro. So ang sasabi po ninyo, and tell me if I'm getting this right. Sasabi po ninyo, dapat wala ng lockdowns and people should just go about their business because that is one way of getting infected is one way of getting immunity as well. Please tell me if I'm getting it right.
Yeah. Actually, it's not exactly like that, but yes, we want to lift the lockdowns because it doesn't work. But it doesn't mean we're not going to do anything. So what it means is that people think actually that if you don't have lockdowns, but if you isolate the sick, you protect the vulnerable, it's enough. It's enough to protect people from dying. It's enough to control the disease. Lockdowns in itself, where you have to stop school, for example, where it's already a known fact that children hardly get sick from this disease, and yet we are not allowing schools to open. So that's an example of how lockdowns don't work. You lock down the children, you don't let them go to school, but it won't have an effect.
Okay, doctors, don't get us wrong. I think we all agree that we want to have as much mobility as we can. We want to be able to move around. We want to open up the economy. I think everybody agrees on that. We don't want the restrictions imposed on us. But at the same time, there are concerns that, and you can't avoid these concerns. There are concerns that the more movement that you have, the more transmissions you'll probably have. So if I may ask for you, if I may ask for you, you guys, you doctors, how will you convince people? How will you convince government, for example, that having people moving around, even with the protocols, even with physical distancing, even with masks, having more people in the streets, in the malls, in their offices, will not result in more infections with more aerosols moving around. Diba? It does sound counterintuitive po kasi. To be honest, it does sound counterintuitive. How will you convince people that works?
We don't actually want people just to start crowding around and not follow protocols. But we want a smarter strategy, because the reason there is a smarter strategy, believe it or not, there's a WHO 2019 pandemic plan. Now that 2019 there's a WHO 2019 pandemic plan in October.
Okay.
There was already a plan just in case something like this happened. And it did not involve lockdowns. It did not involve quarantining big cities. It did not involve that. What it involved was isolating the sick, protecting the vulnerable part of the society. So there was a plan, and it was not suddenly just thought of as an experiment. So matagal na yan, 10 years ago para pinaplano yan, and in 2019 they published it. It's on the net. Type it down, WHO 2019 pandemic plan. So, what happened? Someone pushed the lockdown because of the Imperial College of London's prediction of the numbers. They thought, based on their predictions, there will be 200 million people dying worldwide. But
so the mortality, it's the mortality that
is what they predicted. Yeah, it was 200 million, and right now it's around 1.5 million. So they actually overestimated it. So they've been blamed for that, but they've said it's the worst scenario prediction. So they're saying, why don't we go to a little bit to the reality, where it's really 1.5 million. This is a pandemic. It will cause problems. It will cause deaths. But it's not as bad as it was predicted. So we should just go back to the original plan, which is not locking down.
And we also have to put into context. We also have to put into context. If we have the COVID pandemic, it doesn't mean that there will be no more people dying from tuberculosis, the flu, cancer, heart disease. It's still going to be there. I think that's what we have to consider and look at the bigger picture. You're preventing people to go to the hospital because everybody is scared to death of getting COVID, to the point that they'd rather die at home. because, they don't want to go to the hospital. So I think we have to consider that.